Right, so let's take a look here. Okay, so overwhelming response for C, although quite a few persons selected some other structures. So let's discuss. So we're looking at this structure here specifically, and while most of you said the epididymis, and that is correct, we want to make sure we're differentiated from two similar structures, which are the scrotum, quite a few selected, and then the ductus deferens. Okay, so the ductus deferens is this duct-like tube that we see going from the epididymis itself, going all the way, traveling toward the urethra, where it will communicate the sperm that is being produced in the testes, matured through the epididymis, and sending that all the way to the shared opening here, which is where it enters the urethra. Okay. We also want to differentiate it from the scrotum. So the scrotum is really just the skin-like sac in which the testes are housed. So this outer covering here being the scrotum, the inner covering, right? So you can see there are two different layers here, is the tunica albuginea. So tunica albuginea is an extension that goes all the way over the penis as well as the scrotum, or sorry, as well as the testes, whereas the skin itself is going to be the scrotum. Okay, really important. So this is going to be the epididymis, the connection from the testes where those sperm are made towards the ductus deferens, also called the vas deferens, which is this tube-like communication toward the urethra. All right. Okay, let's look at another question here. Did I jump a few slides? Oops. Okay. Okay, last 10 seconds. All right, let's take a look. All right, so a lot of response for B, which is correct. This is the right ovarian artery. All right, so we're really going to bear in mind that this is a female just because we cannot see the lower anatomy. Now, on a cadaver image or an image that you'll see on your quiz, you will be expected to deduce that this is a female by looking at the lower anatomy. Okay, and I'll show you some images today that'll kind of put that into perspective. So once you identify the gender, then you can differentiate specifically which vessel, and then this will obviously be the right. All right, so the correct answer here, right ovarian artery. Let's take a look at another. And I did want to, before we move on, just touch on this. We'll talk more about it with the cadaver images, but notice the asymmetry between the veins, so the gonadal veins. We're seeing that the gonadal vein is coming off of or communicating to the inferior vena cava on the right side, but it is communicating to the renal vein on the left side. So there is some asymmetry with the gonadal vessels, right? So both testicular and ovarian, the vein structure is going to communicate to the inferior vena cava because it's just more convenient. It's on the right, but then the renal vein is the more convenient major vessel that the testicular or ovarian vein will communicate to on the left. All right, so just a bit of asymmetry that again we'll touch on when we look at some of the images. Let's look at two more questions here. So let's look at another. All right, 10 seconds left. Okay, let's see. A lot of response for D. D is correct. So this is the renal column. That's what E is indicating. A, renal papilla is going to be the tip of the renal pyramid. B, pyramid is going to be the entire pyramidal structure here. And then C, minor calyx is going to be the duct-like tube that the papilla communicates to, okay? And then the strips in between the pyramids are the renal columns, all right? Something else I want to introduce here that we'll talk about as well are the order of the structures at the hilum. So because this is proposed to be the left kidney, we want to think about the order of the vein, artery, and the ureter. So the vein is always first, the artery is always second, and then the ureter is always the posterior most structure. All right. And so it's really important to think about the order of those structures in terms of helping you side the kidney. You should be able to side the kidney just by looking at the order of the structures at the hilum. Okay. All right, we'll take a look at one more and then we will get into some images. All right, last 10 seconds. All righty, let's see. So lots of response for C, vagina, and that is correct. So the vagina is this hollow muscular tube communicating from the outer orifice to the uterus, okay? Not to be confused with the urethra. So here's the urethra communicating from the external orifice up to the bladder. We also want to point out the external os. So the external os is the communication into the uterus. The internal os is a slightly deeper narrowing that actually goes into the uterine cavity. All right, so the external os, the internal os, we'll talk about the fundus up here and then the body being the rest of the uterus, as well as the something else we can see on this view, the sphincter, excuse me. So the internal urethral sphincter, which is the narrowing at the base of the bladder, versus the external urethral sphincter, which is found at the floor of the pelvic cavity or the urogenital diaphragm, all right, which is this strip here. Okay, so let's switch gears here and look at our, let's do this again. Okay, so let's look at some cadaver images and then we will spend the remaining time practicing some of this with an activity. So we're looking at the kidney to start. And here is a view of the anterior aspect of the right kidney. And so again, we want to think about the order of these structures here to really help us make that discernment. Let me just try to get a pointer up. So here is the renal artery. Here is the renal vein. And then here is the ureter at the very back. Now it would appear that the artery is anterior, but when we look at the hilar structures, we're looking at this region. And so while the arteries start branching into those segmental branches, the vein is anterior, the artery is kind of wedged in between the main trunk of that artery, that is, and then the ureter is going to be the posterior-most structure. Okay. Here's a better appreciation of that. So here we can see the cut surface of the kidney here. Here is the ureter, which is the posterior-most structure. Here are the segmental branches kind of coming off in between the ureter and then what would be the vein anteriorly. Looking at the cross-section here of the kidney, we can see the renal pyramid. So these are the renal pyramids. This is the renal papilla. Here are our minor calyces. They converge to form major calyces closer to the hilum. And then we talked about the renal column being these strips in between. Alrighty. Okay, let's get down into the pelvic cavity and start talking about some of the anatomy here, some of the structures that are visible. And so here is a look downward, so kind of a superior view down into the pelvic cavity in a female. So what we're seeing here is the top of the uterus with the broad ligament. We can also appreciate the ovaries. So this kind of glandular tissue that we're seeing here are the ovaries on the left over here, and then on the right over here. And then we can see the extension from the fundus of the uterus via the fallopian or ovarian tubes, right? So here are those tubes that are kind of spanning up toward the ovaries, okay? We can also appreciate the round ligament, so that ligamentous attachment from the uterus that's kind of anchoring the uterus in place. And then we also want to think about that broad ligament. So this entire covering that we're seeing here is the broad ligament. The broad ligament is, if you were to stretch your hands out and throw a blanket over yourself, that's the same orientation that we see with the broad ligament. It's covering the fundus of the uterus, it's covering the ovarian tubes, which would be your arms, and it's spanning the entire width of those reproductive structures, right? It's really a modification of the lower aspect of the peritoneum. Okay, looking at a posterior view here. So on the previous slide, we were looking anteriorly and from a superior perspective. Here we're looking at the posterior aspect of the pelvic wall. And we can see the inferior vena cava here kind of smushed against the vertebral column. We can appreciate the aorta on this side, a little bit more patent. And then we can appreciate some of the vessels that are coming off towards the ovaries. So here, again, is our right ovary, because we've kind of flip-flopped our view. Here's our right ovary. Here is our left ovary, again, that more glandular appearing aspect there. Here is the uterus with the fallopian tubes kind of spanning across, covered by that broad ligament. Here is the round ligament, okay? And the round ligament is going from the uterus out to the labia majum. It's really helping to anchor the uterus in place. The vessels that we're seeing here are the ovarian artery. So we can see how this is slightly more tortuous, where it kind of takes a turns and bends and winds. And that is the nature of the artery. We can also see that it's coming from the aorta, which is another indicator of it being the artery. And because it's a female, which we can appreciate from the lower anatomy visible here, this would be the right ovarian artery. And then we can also see the right ovarian vein, which is going toward the inferior vena cava. Alrighty. Now, what we're seeing smushed to the side here is the sigmoidal colon, which is becoming the rectum as it goes back into the pelvic cavity. And so we kind of have to smush that to the side. It would otherwise be right in this region, kind of taking up all the space. Another view of those structures here, we're actually bringing to the front the ureter. So the ureter is a structure that's often confused with the ovarian vessels or the testicular vessels in males. And so we want to point it out and show how its attaching point and its distal connection is different. So in the back, we can see those gonadal vessels. So here we're seeing the right ovarian artery, the right ovarian vein, and we can see how those are going to the ovary, right? To the ovary, which is here, attaching from the uterus. The ureter is going posterior to those structures and going deeper. It's going to go under the fallopian tubes and then go towards the trigone where the ureteral orifices are in the bladder. So definitely look for where the structure is heading in terms of making that decision about whether it's the gonadal vessels or it is the ureter. I'll also show the proximal point where that ureter arises. It's definitely coming from the hilum of the kidney and not from the major vessels here. Here is the mons pubis. And I forgot to make this disclaimer at the beginning. I usually do, but this is the urogenital system. And so we will be looking at genitalia, which are both internal and external. And so if any of this makes you feel uncomfortable, you're by no means forced to stay here or to view these images. But we will be looking at images which show the external genitalia of male and female. And so if you want to click off and have a conversation with me later, that's fine. But I just want to make that disclaimer just in case anything makes you feel inappropriate or you think that the content will make you feel inappropriate. All right. Just that small disclaimer for students who I know may be a little bit more sensitive to these types of images. Okay. So I'm going to give about a minute just in case you want to exit or raise questions or anything like that, and then we will continue. Right. Okay, so we're looking at the mons pubis here. Again, we're looking at females. So the frontal region of the pubis, the pubic region, is going to be called the mons pubis. This is where we have the genital here and so on. This is the surface landmark to where we have the fusion of the pubic bone. So we have the pubic symphysis located posterior to the mons pubis here. Here we can see more of the female external genitalia. And so what we're seeing here are the labia majum or the labia major, which are the outer folds of the orifice here. We're also seeing the minum to some extent. They're kind of folded on this aspect. You can kind of slightly see them here and here. And then we're also seeing the clitoral hood. Now, the clitoral hood is an extension of the labium. It's a fold that is going to cover the innermost part of the erectile tissue found in females here, which is the clitoris. Okay, what we're seeing here is the prepuce of the clitoris, so the very tip of the clitoral tissue. And we want to think, although it's not visible because we haven't really dissected it out, the clitoris has the crux, right? The crus of the clitoris, which is a larger body of erectile tissue that goes deeper underneath the clitoral hood. All right. Okay, looking at some of the gonadal vessels here once again, and just comparing that to what we're seeing with the ureter as well. So this is still in female, so we're still thinking about the ovarian version of the gonadal vessels. And what we're seeing here is the ureter. So here's the ureter descending from the posterior aspect of the hilum. This is the left kidney, so it's going to be going all the way down. We can see the renal vein stretching across here from the inferior vena cava. And then we can also appreciate the ovarian vein on the left. So we spoke about the asymmetry with the ovarian vessels, specifically on the left side, the vein that is going to the renal vein instead of going all the way over to the inferior vena cava, which is more towards the right. So here's a cut surface of that renal vein, which is communicating, of that ovarian vein on the left, which is communicating to the renal vein, which again is just closer and more convenient because it's already on the left. And I'm just showing you the cut surface of that structure. So here we can see the ovary down here. So it's glandular strip of tissue there. We can see the fallopian tube somewhat. And we can see that this is the ovarian vein coming from the ovary, going to dump into the renal vein, and then that blood will go toward the inferior vena cava. And then in contrast, we can see the ureter, which is going from the hilum all the way down towards the bladder. Just another view of the same exact structures. I won't spend too much time here, but we can appreciate again the ovaries. Here we can see the fallopian tubes kind of spanning on either side, the fundus of the uterus on top here, and then all of that being covered by the broad ligament. In contrast, we can see the round ligament. So the round ligament is this strip-like ligamentous attachment going towards the wall of the pelvis and really anchoring that uterus anteriorly. Now my hand is kind of covering the opening of the bladder. So in dissecting this out, we actually cut the top of the bladder, and you can see the bladder opening here. But remember, the bladder is going to be anterior to the uterus, and so we're going to expect to see it in front of the fundus of the uterus, whereas the rectum, which is this entire structure here, is going to be posterior. Okay, here is a cross-section. This is a better view. Here's a cross-section along with a mid-sagittal section. So we're going right down the middle from a sagittal point of view, and we can see the pubic symphysis, which is the joint that anchors both pubic bones. We can see the bladder here anteriorly, right? Really made of that detrusor muscle, which is what controls the bladder. We can see the internal urethral sphincter versus the external urethral sphincter, okay? In contrast to the urethra and those sphincters, we can see the vagina. So here's the vagina, which is that hollow muscular tube that communicates up toward the uterus. And then the very most posterior structure is going to be the rectum. All right. Okay, let's try to get a better view of the os. So I talked about the two narrowings that communicate to the uterine cavity. So here's the vagina, which is that tube that we talked about, kind of dips here and goes all the way around. Here is the external os versus the internal os, right? The internal os is after we pass that narrowing, which is really the cervix, that's really tightly closed, then we get into the entrance towards the actual uterine cavity. Okay, this is going to be the fundus on top here, whereas the majority of the rest of the uterus here is going to be the body. Okay. And we can see how small the uterus typically is, although these structures, so both the ovaries that I was pointing out earlier, along with the uterus, they're really smaller, really much smaller or atrophied in the cadavers of the age that we typically see them. So some of our cadavers are upwards of 60s, 70s, and this is way past reproductive years. And so what we see after menopause is that the reproductive organs in females more so really significantly atrophy. So they're much smaller in size. The ovaries become much more atrophied. We can see that they're really, really small, almost like just a flap of a fatty tissue. The uterus also becomes quite small. But the uterus is not much larger than this in an unpregnant woman, right? But this is much smaller than it would be. We can also appreciate the fimbriae here to some extent, which are the endings of the fallopian tubes. This is what kind of sweeps the ovum into the fallopian tubes and sends it towards the uterine cavity. Okay, let's get into some of the male structures here. So we've got the cross-section of the penis, or a cut section of the penis here. We can see the two bodies of erectile tissue, which are the corpus cavernosum, right, on either side. And then we can also appreciate the singular body of spongy tissue, which is the corpus spongiosum. And if we look even closer, we can appreciate the urethra, which is running through the corpus spongiosum. And so we would have talked about the three the three divisions of the urethra. It's got the membranous portion, which is the smallest portion. It's got the prostatic part, which goes through the prostate. And then it's got the longest part, which is the spongy urethra that runs within the corpus spongiosum. Okay. All right, a better view of those erectile tissues. So again, corpus cavernosum, which are paired, versus the singular corpus spongiosum. Here we can see the glans of the penis, which is the very end of the penis, versus the prepuce of the penis, which is this skin on top. And then while it's not quite visible from this view, we also have the frenulum. And the frenulum is the strip of connective tissue that attaches the prepuce to the glans, right? So again, the prepuce being the outer fold versus the very end being the glans. Okay, looking at some of the vessels here in males, again, the asymmetry that we see with the veins is also true here for the males as well. So the testicular vein is going to be coming from the inferior vena cava on the right, but the renal vein on the left, right? Here we're looking at the left side. We can appreciate the testicular artery, which is the smallest structure that I'm holding here, versus the testicular vein coming from the inferior vena cava versus the ureter, right? Just to give you a sense of how the structures differ. Again, looking at that testicular vein coming from the inferior vena cava, going down toward the testes, you can see that here, versus testicular artery coming from the aorta, you can see that running down here, versus the ureter, which is running towards the hilum of the kidney. And just to point out, this would have been a structure from last week, but can you see all these fatty appendages? These are the epiploic appendices of the distal part of the colon. So this is how we know that all of this is going to be rectum, right? That distal colon has these omental or epiploic appendices. Again, I'm just holding these structures up here just to give you a better appreciation of how they differ. Again, testicular vein on the right, testicular artery on the right, and then the ureter. Just an even closer view of the ureter descending. It's going to be the posterior-most aspect of the hilum there, going all the way down to the urethral orifices. Remember, there are two urethral orifices communicating to the bladder. Okay, here is another mid-sagittal section, this time in males. We can also appreciate the pubic symphysis here again. Both halves of those hip bones adjoining. And then because there is no uterus in males, all we have is the bladder. So here's our bladder kind of smushed anteriorly, and then we have posteriorly the rectum, okay? And then we can see the prostate. So the prostate is going to be this walnut-sized gland that's at the base of the bladder. We can sort of appreciate it here versus the seminal vesicle. So the seminal vesicle kind of sticks up here, and that is different from this walnut-sized gland that we're appreciating here, right? This is really the prostate at the base of the bladder. Here, excuse me, here again would be our internal urethral sphincter versus our external urethral sphincter, which would be a little bit lower, okay? A better view here, we can see our seminal vesicle sticking up from the back there, the entire span of the bladder there, and then our walnut-sized prostate. And this is why we use the rectum as a means of communicating to palpating or to examining the prostate, because there's nothing standing in between the way that there is in females. And so we can get direct communication to the base of the bladder and really palpate the size of the uterus. So putting a few fingers into the rectum, you'll be able to feel if there's any swelling to this prostate gland. Okay, it normally should not be palpable. Also, we can appreciate the ureter here. So the ureter running towards the base of that bladder there and communicating down. So here's that ureter, excuse me. Here's the ureter going towards the base of the bladder. Here we're seeing the ductus deferens. The ductus deferens communicating the contents which are coming from, right, coming all the way through the spermatic cord all the way from the scrotum. So it's going to come all the way around, running in the inguinal region that we would have talked about last week, and then communicating down. So the fluid from the seminal vesicle merges with the sperm that are coming from the ductus deferens, and then that together is known as semen that will enter the urethra and be ejaculated from the body. Okay, a more open view of the bladder here, where we can see the urethral orifice only on the right here. And so the other urethral orifice would have been on the other half of the bladder. Again, we're seeing the prostate here, very small gland, and then a little bit of that seminal vesicle sticking out there. Okay, here are some of the models that we have of these images. I want to go through these, make sure we're comfortable with these structures on the models. So this is the male anatomy. We can appreciate the bladder again, this nice hollow organ here made of detrusor muscle. We can appreciate the internal sphincter versus the external sphincter. We can appreciate the prostate, which is at the bottom here. And then we can appreciate the seminal vesicles, which are sticking off towards the bottom of the prostate, but the bottom of the bladder, but the back of the prostate. Other things we can appreciate in this frame are the ureters kind of running down here, along with the testicular vessel. So the testicular vein, along with the testicular artery going towards the testis. This is where they would end up, towards the scrotal sac, because they are supplying the testes with its blood supply and its venous drainage. Now, the three structures that are running in the spermatic cord, so the spermatic cord is actually made of three structures internally. It's got the vas deferens in it, it's got the testicular artery, as well as the testicular vein. So those three structures together make up the spermatic cord. Also, we can appreciate here the testis itself, which is this structure here, versus the epididymis, right? The duct-like coiled tube that is communicating towards the ductus deferens, which is here, and then that'll go over through the inguinal region and then curl around the base here and communicate into the urethra. Okay, very difficult to kind of visualize from a 2D perspective because of the route that it takes towards the urethra. We can also appreciate the spongy urethra running through the corpus spongiosum, and then both parts of that corpus cavernosum, right, the paired corpus cavernosum. Here we can see the urethral opening. So here's that opening where this structure, the ureter, would pierce the right side of the bladder. And then we can appreciate the triangular region at the base here, which is the trigone. All right. Okay, just another view. This time we actually have both halves on. So that was a mid-sagittal section previously, and I've actually put the other half on so we can see some of the structures better. So here's the ureter on the left, right? This would be the urethral orifice. Here's the prostate at the bottom here. Here is that spermatic cord. So the spermatic cord has within it the ductus deferens, the testicular artery, and the testicular vein coming from the epididymis of the testis. Here's the testis itself, the testis proper versus the epididymis. And then that's going to go all the way through the inguinal region. So here's the superficial ring. We talked about this last week, or last time we met. It goes through the inguinal canal. Then it goes over the base, over the top of the bladder, under towards the base of the bladder, and communicates into the urethra that way. Moving on to some of the female models here, we can see the fimbriae of the fallopian tubes. We can see the ovaries, right? Much more visible from the model. Again, much more atrophied on some of our cadavers because of their age. We can see the fundus of the uterus on top. We can see the body, and then we can appreciate the bladder. So on this model, excuse me, they're showing the bladder kind of resting, or the uterus kind of resting on top of the bladder. And that's what it does. There's usually this analogy that the uterus sleeps on the bladder. It's kind of just slumped over the top of that bladder. Okay, better view of that here. So here's that uterus kind of sleeping on top of the bladder there. The fundus being the top, the body being this region here, this being our internal os, this being our external os, this being the vagina, so that tube communicating outward. Here's the rectum at the back. Here is the bladder, that detrusor muscle. Here is the internal sphincter versus the external sphincter, right? This is going to be the floor of the pelvic cavity, the urogenital diaphragm, if you will. And then this is going to be external urethral orifice versus the external vaginal orifice. Final models here, we're just looking at some of these kidney structures, so the internal structures of the kidney, the pyramids, the papilla, the calyces, the columns, the hilum, right? We're seeing the vein, the artery, the ureter, and then we're going down to where we can see the trigone here, internal orifice, internal sphincter, excuse me, external sphincter. And because this is representing males, we can see the prostate gland here, and then also the uretral openings of the ureter on either side of the trigone.